ক্যানট বলে কেন?
এটা ওই কেসটা নিয়ে
আমি ইয়া দিতে চাচ্ছিলাম।
সরি, না, it's already started.
My dear students, good afternoon. I hope you are all fine and stay safe. Well, I'm Dr. K. Moiz, Professor of Physical Medicine and Rehabilitation. Today my topic is degenerative joint disease. Before starting discussion, I would like to say a few words about rheumatic conditions or musculoskeletal conditions, which comprises almost 150 diseases associated with pain. Among those, the most important diseases which are impact in the society are degenerative joint diseases and rheumatoid arthritis. In the previous classes, my colleagues discussed about the rheumatoid arthritis and hope you understood all nicely. These two diseases, this rheumatoid arthritis and degenerative joint disease, a bit similar entity, but the rheumatoid arthritis is one of the most important and most common case in the 5th year classes, as well in the 5th year examination, both practical and written. So it's very important how to approach to diagnosis the joint diseases like rheumatoid arthritis, because these two diseases, degenerative joint disease and rheumatoid arthritis, are very similar regarding clinical features and all this. That's why I want to highlight here how you go for diagnosis the cases. So let's start the degenerative joint disease. This is a road map. It shows the motor road map, protective mechanism of synovial joints to convolutions. And I hope you will enjoy and understand these topics about degenerative joint disease. Comes to the first, protective mechanism of synovial joint. Here shows the figure. You will see muscles, the ligaments, tendon, synovial capsule, synovial membrane, and as well as articular cartilage with bone. These all together protect the joint of the synovial. So this, you have to know that these are the contents of the articular joint which protect the joint. Comes to the what is degenerative joint disease, which is also referred to as osteoarthritis, or you can say osteoarthrosis. Now comes to the definition. Osteoarthritis is a degenerative disease of diarthrodale, that synovial joints, which is characterized by breakdown of articular cartilage and new bone formation at the base of the cartilage lesion, that is subchondral bone, and at the joint margin, which is called osteophytes. Epidemiology. Osteoarthritis often begins with the third decade of life and peaks between the fifth and the sixth decades. By 40 years of age, 90% of the population has degenerative joint changes in their weight-bearing joints, mostly in the knee joint, as well as the back. Prevalence of osteoarthritis is between 50% and 80% in the elderly. Increasing the age directly related to the degenerative process in the joint. Overview about the degenerative joint disease is the most common arthropathy rather than rheumatoid arthritis, because this osteoarthritis is almost invariably seen in our day-to-day practice rather than rheumatoid arthritis. Becoming the fourth leading cause of pain and disability. See here, can affect any joint, but is most common in knees, hands, hips, shoulder, and spine, mostly on the cervical spine and lumbosacral spine. Symptomatic knee osteoarthritis occurs in 15% of adults more than 55 years old, which begins at the age of 40 years, but their symptom may be present or not. Radiographic incidence of more than 80% in those who are 75 years old. These are the sites commonly affected joints. You see here the cervical spine, lumbar spine. In the hand, you see the distal interphalangeal joints, the most common sites of the hands, or the knees and hips, and the foot MTB joints. These are the most common sites of osteoarthritis which affect commonly. Risk factor is a very important. Before diagnosis the case, you have to know the risk factor. Number one, older age. Osteoarthritis typically occurs in older adult. People under 40 years rarely experience osteoarthritis. Sex. Women are more likely to develop osteoarthritis, but the early age, around 40, male are more common than female, though the cause is still not clear why the women are more common in the elderly for osteoarthritis. But it seems to be hormonal some changes in the female, maybe the priority goes to women. Bone deformities. Some people are born with malformed joints or cartilage, which can increase the risk of osteoarthritis. Joint injuries. Injuries such as those that occur when playing sports or from an accident may increase the risk of osteoarthritis. Here, the age is not limited. Any age can be when joint injury. Obesity. Carrying more body weight places more stress on weight-bearing joints, such as knees. But obesity has also been linked to an increased risk of osteoarthritis in the hands as well as back. Genetics. Some people inherit the tendency to develop osteoarthritis. Certain jobs, physically demanding jobs, or jobs that require repeated stress on joints can increase chance of developing osteoarthritis. Hypermobility, having hypermobile joint or loose ligament can increase the risk. Other diseases, bone and joint diseases that increase the risk of osteoarthritis include gouty arthritis, rheumatoid arthritis, Paget disease of the bone, septic arthritis. Now comes to the classification. May be classified as primary and secondary. Primary mostly problem maybe aging per aging is the most common. Secondary, there's lot of causes in this category. Chronic form of arthritis like rheumatoid arthritis, ankylosing spondylitis, costochondritis, gout, trauma or injury, maybe accident or orthodontic operations. Septic arthritis, infection of a joint, most probably non-gonococcal arthritis is one of the most important examples of septic arthritis. Congenital disorder of the joints, metabolic diseases like hyperparathyroidism or hypothyroidism, hemochromatosis, ochronosis, etc. Pathophysiology. Osteoarthritis is traditionally thought of as wear and tear disease which occur as we age. However, recent research suggests otherwise. The pathogenesis of osteoarthritis involves a degradation of cartilage and remodeling of bone due to an active response of chondrocyte in the articular cartilage and the inflammatory cells in the surrounding tissue. The release of enzymes from these cells break down collagen and proteoglycan, which destroy the articular cartilage. Exposure of the underlying subchondral bone results in sclerosis, followed by reactive remodeling changes that lead to the formation of osteophytes and subchondral bone cysts, which is a main causes of pain in the articular joint. The joint space is progressively lost. That means reduction of the joint space over time being. Here shows the pathophysiology. You see the first picture, there is a normal articular joint where the space of the joint is very clearly shown there, and the articular surface is also smooth. Early degenerative change where you see the breakdown of the articular cartilage gradually, and the osteophyte formation also started. Here she show here is the osteophyte nipping. In advanced degenerative changes, you will see here the exposure of the bone on the surface of the cartilage, and you see here the space is going to be reduced and the cartilage become distracted more and more. And this is the osteophyte shown here also. These are the osteophyte nipping. outgrowth of the bone in the articular joint. Here's another picture shows here. You see minimum disruption there. Only 10% cartilage loss here. Here we see there's a breakdown started. Here is a breakdown started. Here also. And there's osteophyte formation started here. In the modern joint space reduction started, modern joint space reduction gaps in the cartilage can expand until the reach of the bone. Here's a cartilage breakdown shows here. And 60% of our cartilage already lost and the bone exposed here. And these are the osteophyte. See? Now comes to the history and physics. This is very important for you because osteoarthritis or degenerative joint disease basically diagnosed by means of history and physical examination. So we have to be careful for the history taking and physical examination to reach the diagnosis. In history, you have to take the history age, mostly 50 above. Whether the patient is obese or not, you have to find it out. Occupation, what type of occupation? Because occupation is very important in case of osteoarthritis. Is there any history of trauma that involve the joints? Rule out secondary causes like congenital or inflammatory changes like rheumatoid arthritis there or not. Any joint pain, if the joint is present, whether become worse by activity or relieved by rest, because this is the most important to distinguish between rheumatoid arthritis and degenerative joint disease. Because in osteoarthritis, you will see the worse by activity but relieved by rest. On the other hand, in rheumatoid arthritis, you will find by rest patient feel worse. If you go for movement or activity, it becomes relief. Usually patient complains whether cannot walk for a long time, a long distance, or stand for a long time, or prolonged sitting, all are present in the osteoarthritis cases. So you have to ask all the questions when you take the X-ray. Then goes the joint stiffness, early morning stiffness. You will find this early morning stiffness both in the rheumatoid arthritis also, as well as in osteoarthritis. But the main difference is early morning stiffness in osteoarthritis disease were less than 30 minutes. But on the other hand, the rheumatoid arthritis, it should be more than 30 minutes, this early morning stiffness. But you will see long rest. If you go for long rest, for prolonged sitting or prolonged standing, when you go and change the posture, then you will find any gelling effect. That means brief pain over there in the affected joint. Then goes for notice swelling, whether the swelling or not. Again here swelling is two types. You will see the swelling is around the joints or inside the joints comes. So you will find out. You will see that swelling. Ask daily activity affected or not. You have to ask the patients with their daily activity affected or not. Climbing stairs, that's important. Maybe feel pain during climbing. How to pray? If Muslims, whether they pray in sitting position or normal position, is all I have to ask the patients by taking history. Houseworks, cooking, laundry, etc. Usually only one or few joints painful, not multiple region pain. But on the other hand, in rheumatoid arthritis, you will see the polyarticular joint pain you will find. This is another one of the most differential point between rheumatoid arthritis and degenerative joint disease. Onset, also another point you have to ask whether it comes month or years. But in case of rheumatoid arthritis, we'll see the onset may be acute, which lasts for week to month. We know the rheumatoid arthritis criteria. We'll see 6 weeks or more than 6 weeks. The pain persists, then we go for the diagnosis for rheumatoid arthritis and taking this field. It is important to differentiate between two. Goes to the physical examination. General examination, whether the patient is elderly or obese lady, you have to see. Inspection, until they get the way of walking, until they get the way of walking, it's quite difficult during walking on the affected side. There is a varus deformity, mostly common in case of knee joint arthritis. You see here, there is a varus. Valgus deformity also present, but varus is very common and found in the osteoarthritis. Muscle wasting or the quadricep area also fine due to prolonged rest of the joint. Joint swelling is there shown, but there is no redness or discolored because in case of inflammation there is redness. But in osteoarthritis, inflammation is rare in case of primary cases. Then goes the bony enlargement of the DIB, that is Haberton nodes we are getting, and PIP, proximal interphalangeal joint, so-called Booker's nodes, are occasionally prominent, but not invariably. We are found this sort of nodules in the hand joint in case of osteoarthritis. You show the pictures. We find here in the distal interphalangeal joint, we find the nodule, which is so-called Haberton's node, around the PIP, which is so-called Booker's node. So these are the shown pictures clearly here, the nodules in case of osteoarthritis. But in rheumatoid, you will not get this sort of nodules. Now goes the palpation. There is a minor or no joint effusion if you go for patellar tap, because most of the osteoarthritis cases, especially the knee joint, swelling found around the joint, but not the interarticular, because effusion mostly occur in case of inflammation is there, mostly commonly found in rheumatoid arthritis, is joint effusion. So we have to test by patellar tap to exclude the disease. Then crepitus. This is important in case of osteoarthritis. May be often felt over the knee, mostly. The check for tenderness. There is a joint line here. If you palpate here, you will find the tenderness, periarticular area or joint line. Synovial membrane not thickened, because synovial membrane thickened in case of rheumatoid arthritis, not in osteoarthritis. But osteophyte, bony outgrowth at the edge of the articular cartilage, you can feel here, osteophyte. What are the stages of osteoarthritis? Basically, in the arthritis knee, there is 4 stages of osteoarthritis. Stage 0, normal, when the knee shows no sign of osteoarthritis, it is classified as stage 0, which is normal knee health with no known impairment or sign of joint damage. Stage 1 is a minor sign of impairment or joint damage. Stage 2 is a mild sign of impairment or joint damage. Stage 3 moderate, and stage 4 severe. Now comes to the diagnosis. Investigation. I told before that osteoarthritis is primarily a clinical diagnosis. Investigation can be used basically to exclude the differential diagnosis. If you go for routine blood test, you can be useful to exclude inflammatory or infective or any other cause rather than osteoarthritis. Here shown the CBC follows normal, ESR normal, CRP normal, rheumatoid factor is also negative in case of osteoarthritis. Plain X-ray or radiography. This is very important in case of osteoarthritis. X-ray can show anatomical changes that reflect important pathological processes, although earlier in this disease there may be no X-ray changes. Most changes have low specificity, combinations of features and targeting of certain bones or joints, resulting in characteristic patterns that have high diagnostic specificity. You see here, the classical radiological feature of osteoarthritis are loss of joint space. You see the X-ray, loss of joint spaces in the knee joint, especially here shown. Osteophyte, find here osteophyte, some osteophyte here also in the pattern area, in the and also in the axial lumosacral spine. You will get the osteophyte in both lateral view and epi view. Subchondral cyst, he has not shown the subchondral cyst. Subchondral sclerosis, you will get here the subchondral sclerosis. Maybe here also seen the subchondral sclerosis. So these are the radiological classical features of osteoarthritis. This is most important to diagnosis the osteoarthritis. We can go for joint fluid analysis, which is not for osteoarthritis, but to exclude the osteoarthritis. Might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether pain is caused by inflammation or infection or other than osteoarthritis. Magnetic resonance imaging. MRI is used to produce detailed image of bone and soft tissue. We know it, including cartilage. MRI is not commonly needed to diagnose osteoarthritis, but can help to provide more information in arthritic joint. The loss of normal cartilage on the joint surface we can find in MRI. But basically, to exclude the osteoarthritis, we can use MRI. Arthroscopy is a surgical technique whereby abnormalities of damage to the cartilage can be diagnosed. Not only cartilage, also ligament is detected and sometimes repaired through the arthroscopy. Basically, arthroscopy is required for treatment purpose. In case of osteoarthritis, mostly commonly, orthopedic surgeon can do this arthroscopy for detect and as well as treatment purpose. Differential diagnosis. The differential diagnosis is very important to diagnose the case of osteoarthritis, which depends on which area of the body is affected. However, some universal conditions include inflammatory arthropathy like rheumatoid arthritis, ankylosing spondylitis, and so on. Distal arthropathies like gout or CCPPD, septic arthritis, fractures, bursitis, malignancy, whether primary or metastatic. These are the most common differential diagnoses for osteoarthritis. On the other hand, joint-specific differential diagnosis for osteoarthritis in the case of hand, decurrent tenosynovitis or decurrent disease, rheumatoid arthritis, gouty arthritis. In case of hip, you can go for trochanteric bursitis, radiculopathy, which comes from the low back, special lumbar spondylosis, or PLID. You can go through spinal stenosis or iliotibial band syndrome. In case of knee, referred hip pain, meniscal or ligament tears, or chondromalacia pattern. This joint-specific differential diagnosis for osteoarthritis. They are shown a normal joint, articular joint. This is osteoarthritis. They are shown that there is an articular destruction. But on the other hand, in rheumatoid arthritis, articular surface is intact, but the synovial membrane inflamed. This is synovial membrane. Inflammation of the synovial membrane, and there is a collection of fluid that is called effusion is found in the rheumatoid arthritis. But on the osteoarthritis, you will not get any inflammation for the synovial membrane, but only articular cartilages destruction and space is reduced, but in hair space is intact, generally in the early cases. And these are the different sides of involvement of osteoarthritis and rheumatoid. This is the most common differential point between these two. We see DIP, distant mostly occurring the osteoarthritis. On the other hand, PIP, mostly common the rheumatoid arthritis, as well as MCP, metacarpophalangeal joint, both in the toes and hands, feet and hands. But here, mostly large joint, knees, hip, shoulder, these are the joint affected mostly. Now comes to the goal of treatment. In the core goal of osteoarthritis treatment, to control pain, number one, important, have to decide to pain control. Then goes to improve the joint function, then to maintain normal body weight, to achieve a healthy lifestyle. These four goals should be remembered for treatment. Management. There is a conservative management, medical management, surgical management. In physical medicine department, the most we are emphasis we are give the priority for conservative treatment rather than surgical. Number one is education. It's very, very important to treat the osteoarthritis. Education is most important. Then go for exercise, weight control, and non-drug pain relief techniques and alternative therapies. Education. Success treatment depends on the patient's understanding of the disorder and accept their role in recovery. A back school is an education program that teaches practical information about self-care, postural education, body mechanics, exercise, and lifestyle changes, which is most important lifestyle changes to treat the patients of osteoarthritis or degenerative joint disease. Exercise is a part of in our subjects. Research shows that exercise is one of the best treatment for osteoarthritis. It includes improved mood and outlook, decreased pain, increased flexibility, strengthen the heart and improve blood flow, maintain weight, and promote general physical fitness. The following types of exercise are part of well-rounded arthritis treatment plan. Aerobic activities which can be done by any affected persons. Walking, swimming, water aerobics. These are common activities can be done by the affected person. Strengthening exercise are the one most important to strengthen the muscles of the affected joint and enhance the movement and activity. Then goes the range of motion activities, balance and agility exercise. These are the exercise pattern we can give the advise the patient to relieve the pain as well as improve the function of the joint. Weight control is very important in case of weight bearing joint. If you are overweight or obese, you should try to lose weight. Weight loss can reduce stress on weight bearing joints, limit further injury, increase mobility, reduce the risk of associated health problems. Non-drug pain relief and alternative therapies. People with osteoarthritis may find many non-drug ways to relieve pain. Some examples there in our department, in our hospital, we find some of the modalities we are applying in case of osteoarthritis patients, like heat and cold therapy, TENS, transcutaneous electric nerve stimulation, shortwave diathermy or microwave diathermy, massage, acupuncture, and so on. But these are the TENS, shortwave, microwave. Invariably, we are applying to the patient in our department. Very effective for relieve the pain and improve the movement of the joint. Now goes the drug treatment. Mild pain, you can use a paracetamol or acetaminophen. If there is a bit pain is more, you can go for non-steroidal anti-inflammatory drug. So many anti-inflammatory drugs there, like naproxen, ibuprofen. You can try. Muscle relaxant, basically in case of back muscle, we can apply the muscle relaxant to relieve the pain. Chondroitin sulfate glucosamine, which is on trial basis, you can apply this chondroitin sulfate for a long time in case of osteoarthritis patients and get a very remarkable result. Tenezumab monoclonal antibody also used not in Bangladesh but out of Bangladesh. Some of the countries in Europe, America, tenezumab can be practiced. Anxiolytic drug is used To relieve the pain, especially when the pain more marked at night and hamper the sleep, we can apply the anxiety drug to relieve the pain and give the sound sleep to the patient. Intra-articular injection like artificial synovial fluid, which is called viscose supplement. This is very, very important. It's practicing nowadays to avoid the surgery, which is very helpful. Viscose supplement, which relieve the pain by means of recovering of the affected affected articular joint cartilage, and there is a remodeling of the cartilage by means of these two activity. Articular joint supplement, viscous supplement can be used intraarticularly. Basically, in the knee joint, it can be used. Steroid to relieve the pain by intraarticular for the temporary basis, but oral steroid cannot be used in case of osteoarthritis. A role of steroid is used in rheumatoid arthritis rather than osteoarthritis in oral form. Enzyme inhibitors, chondroprotector, these are also used in intraarticularly to relieve the pain and recover the destructive cartilage, articular cartilage. In the picture shown that given the intraarticular in the wrist joint. Surgery. Surgery is the end stage of the treatment where all the treatment fail. Then we go for surgery. Basically, we are going for implantation, chondrocyte, autologous chondrocyte implantation, microfracture surgery, arthroscopic surgery, osteotomy, limb lengthening. After this, it's joint replacement. In Bangladesh nowadays, joint replacement is started, even in Syria also. Basically, in the knee joint and hip joint replacement therapies is going on. What are the complications of osteoarthritis? Osteoarthritis is a source of chronic pain that can be exhausting and debilitating. There are a number of ways in which osteoarthritis can impact in life, like sleep disruption, reduced productivity, weight gain, anxiety and depression, other complications like stress fracture, bleeding or infection in joints, bone death, peripheral neuropathy. These are the complications you'll find in the osteoarthritis. Prevention. Making certain lifestyle changes can help to improve joint health and prevent osteoarthritis. When manage occupational risks, jobs that involve a lot of repeated motion can be hard on your joints. Basically, in Bangladesh, like poor country, even those who are doing hard labor, like farmers, rickshaw pullers, and they invariably affected the joints like knee joint, hip joint, back. So they need the change of occupation. That means a lifestyle change is most important to prevent the osteoarthritis. Exercise, low impact exercise can improve joint health. Maintain a healthy weight. Excess weight puts additional pressure on weight bearing joint. You know, hips, knee, and back are the most weight bearing joints. And if you go for reduce the weight, you can avoid from osteoarthritis. Then rest. Rest also important to prevent the osteoarthritis. Control blood sugar. Protect joints by using firm mattress, soft pillow, etc. Prognosis. The question comes to whether osteoarthritis is curable or not. The long-term prognosis. Osteoarthritis is a progressive degenerative condition. So without effective treatment, it will likely continue to get worse throughout your life. However, with treatment, the symptom can often be managed, and if you choose surgery, you will experience lasting relief. Now comes to the conclusion. Degenerative joint disease is a significant contributor to disability and burden on the healthcare system. That means it's a burden to the family, society, and the country. The aging population will result in increasing the prevalence of osteoarthritis and associated socioeconomic costs. Education and lifestyle changes can help to improve joint health. And we are emphasis to this category education and lifestyle changes. Very important to improve joint health. Currently available viscosupplementation products have proven to clinical benefit for treatment of osteoarthritis of knee. That's all today. Thank you all.